Hi everyone, welcome back to Healthy with Nicole. I'm Nicole Carter, UC free for 6 years and counting. So in today's video, I wanted to talk about a therapy that has been used for thousands of years to help clean and detoxify the colon and the body, and whether or not someone with ulcerative colitis should use that. And that would be colon cleansing with coffee enemas. So if you're someone that's ever used a coffee enema, you know that there's a lot of great health benefits to it. It's been around for a long, long time, used safely for thousands of years to help clear toxins from the liver. And a lot of people do use them. It's nothing new, but there's been a lot of talk and questions about should people with ulcerative colitis or inflammatory bowel disease be using them? So I thought this would be a good topic to address because I have been using coffee enemas for about 6 months, maybe about a year, and I really like them. I don't have UC symptoms though, so I think there's some ways that you might want to use it or not use it if you do have an existing condition. So first of all, let's talk about what is a coffee enema and why you would even want to do it to begin with. So as the name suggests, it's basically just an enema but made with coffee. And the purpose of the coffee is the caffeine goes into the portal vein through to the liver and I guess dilates the liver, and it helps to remove toxins that are in the liver as well as bile flushing through the liver into the colon. And this allows your body to excrete it out through the colon. And a lot of people do store, we store a lot of stuff in our bodies. Your liver is the main filter of your blood. So it's cleaning out everything that's in your bloodstream. So yes, your body is always exposed to toxins through the air we breathe, through your food and drinks, through your skin. And so we are, even if you are eating a really healthy organic diet and you don't put any chemicals on your skin and you don't use toxic cleaning agents, you still are exposed to a ton of chemicals in the environment. Whether it's just, in your home, all of your furniture, your flooring, your cupboards, they all off-gas chemicals. Out where you live, there is, exhaust, there is whatever they're spraying in the sky. There are chemicals in the air. And in our water, most of us filter our water. But what about the foods that are grown in that water? So groundwater can be contaminated as well. So there are pesticides, dioxins, there are heavy metals, there's all kinds of things that are in our environment. And add to that anything you would put on your skin, chemicals from cosmetics, anything like that. So there's no question we are absorbing, and we have in our bodies chemicals from everything you can think of. And you can get blood work done to see some of this stuff. But I would say, just assume that it's there, and doing things that are harmless and don't have any negative side effect, why not? However, with people that have ulcerative colitis or inflammatory bowel disease, I do have some questions. And even though I think coffee enemas are great and I would recommend them for almost everyone, if you have colitis and you are in an active flare, meaning you have multiple diarrheas per day, you have bleeding, you have pain, or maybe even a fever, that is probably not a great time to use a coffee enema. And the reason I say that is because when I'm working with people, I'm trying to get their intestines calmed down by not giving the body anything that would irritate the colon, to give people a way of eating that is basically eliminating fiber, because that's another irritant. And so I don't think it's actually a good idea to be doing anything unnecessary, including what might be beneficial in other conditions. So I am going to suggest that if you have an inflammatory bowel disease, that if you are having an active flare, that you probably just wait until that active flare is done. I have a lot of ways that I help people to get through flares and get through them quickly. There's a free download you can go to my website and get, which is the UC Survival Guide, telling you really all the different things that you can utilize to help you to get through a flare beyond whatever your doctor is giving you for medication. These are just things with diet and stress and things like that. So once you get through a flare, I think then might be a really good time to try doing a a cleanse. And what I mean by cleanse is really just coffee enemas. If coffee enemas are too strong, you could start with like a castor oil pack. It's still working on your liver. But this video, I wanted to just really talk about coffee enemas and whether or not you should do that, if it's beneficial, and how to do it. So back to the people with UC, I haven't found any evidence. There's no clinical evidence, no clinical trials or anything like that on coffee enemas. You might be able to dig and find some information that's negative, but I've talked to lots of people and practitioners all over the world that are using them for their clients and have used them for years and with thousands of patients, and not one has ever experienced anything dangerous. So will you experience discomfort? Maybe, because it is a detoxification method, and when you start mobilizing toxins in your body, you might feel that. It might feel like nausea or something like that, but for the most part, people feel great after they do coffee enemas, and you can do them very regularly and it's safe. So you might want to start with doing one a week and maybe work up to one a day is probably fine. I do it once or twice a week, and that's what I feel is good enough. People use it to detoxify their liver. They also use it for parasite cleansing. Parasites are very, very common, and I have seen people that do herbal parasite cleanses while working with me, and does make a difference in the reduction of symptoms. So parasites can cause inflammatory bowel disease symptoms: pain, bloating, gas, bleeding, digestive problems, but also really common is chronic constipation, because they cause kind of a paralysis in the intestines and slow motility. So common, very common parasites. I don't think there's any harm in doing a cleanse for that. Why not, right? It definitely can give you some symptom relief and make you feel better. So with that, you might want to start slow, doing that one a week, and then eventually working your way up. As far as how much to do, well, when you do a coffee enema, you typically are going to use anywhere from 2 to 4 cups of water. That's about it. Some people go higher, but I don't think that that's necessary at all. I usually do a 4 cup in a kit. So I'm going to put a link in the description below with the Amazon link to the kit that I use. It's basically just a stainless steel bucket with a hose and then an attachment that goes into the rectum. And it sounds scary, but it's really not. It's really very simple. So you'll use that container to put your coffee in. So the way you make the coffee is, I usually use 4 tablespoons of coffee to 2 cups of water. And then I add 2 cups of cold water to come to a total of 4 cups. You can also cut it down to less. So if you're sensitive to caffeine, you might want to just start with 1 tablespoon of water to 1 tablespoon of coffee to 2 cups of water. And then you bring that to a boil and turn it off and let it sit for 20 minutes, strain it out, and add the 2 cups of cold water. So now you have a total of 4 cups of coffee. And again, you can determine how strong you want that coffee, but you do want it to have caffeine. That's what helps to clean the liver. So once you do that, then you will filter out you'll strain it, and you'll have this 4 cups of coffee that's ready to go. You want the water to be room temperature. So just basically tepid, nothing hot, because obviously that could hurt your intestines. So room temperature or tepid or cool would be my suggestion. Not cold, because that can also feel uncomfortable. I've done it with cold, and I don't know, it didn't feel great to me, but it won't hurt you. Hot water though could hurt you, so just be careful with that. And then once you have your coffee done, then you basically just set up your area. So I use my bathroom, and I put a couple towels on the floor, and I have a couple big pillows in there so that I can kind of lay there comfortably for a little while. When you do the enema, you want to try to retain it for about 15 minutes, maybe 20 minutes. Some people go 30 minutes. And you probably won't do that the very first time, or even the first few times you do it, because you're not used to it. So you might start off with just holding it like 5 minutes, and then you're going to feel like you want to go to the bathroom. So then you just let it go, and then you can do that second half. But again, you're just holding it until you feel like you need to go, up to 15, 20 minutes. So it's very flexible. And when you do this at first, it's going to feel awkward and weird, but after you do it a couple of times, I think you'll notice that it's not that big of a deal. It's nothing super uncomfortable. It's just different. And so try doing that and see how you feel about it. And if you feel comfortable with it, again, just make your area comfortable. And then, you release all that fluid and you're good to go. So after that, then you just clean everything up. I just throw all the towels in the laundry. It's not messy, but sometimes you might leak or drip a little coffee. And so that might be a good time. Just clean everything up and throw it in the laundry. And it's very easy. So you might have a little bit of coffee drips here and there. That's normal. After you're done, then you just rinse out your bucket. You take the tip off, which you have used. So by the way, you can use some kind of oil to lubricate that if that makes it more comfortable for you. And then, so you'll want to wash that with hot soapy water. You can take the tubing off of the bag or bucket if you want to, or you can just run hot soapy water through that. It's only coffee that's been in there. Nothing is going from your rectum all the way through that tubing. So it's not like the whole thing needs to be sanitized, but some people do wash it out with soapy water and then run some peroxide through it. You don't necessarily have to do that, just hot soapy water and then let it all dry until the next time you use it. So just a quick recap. So coffee enemas are safe to do. If you're not in a flare, that's a better time to do it. If you're in a flare, I would wait because you don't want to cause any additional irritation to your colon. You can start with 1 to 4 tablespoons of coffee per enema, and you'll use a total of 4 cups of water. Start with 2 cups to boil and then add additional 2 cups cold so that your water is room temperature or cooler. You'll want to make sure you use a good, clean, purified water. Then you're going to do the enema. You'll probably do 2 enemas. If you have 4 cups, you're going to do it twice. So you'll go about 1.5 to 2 cups each time and hold it for as long as you feel comfortable. You have a little lever clasp on the tubing that will allow the speed of the enema to be controlled. So you can go slower or faster if it feels uncomfortable to you. And then you'll just retain that for as long as you can. And then you go to the bathroom, let it all go, and then do it one more time with the remaining coffee. And again, retain as long as you can. Release that all, and then you're good. And then just, wash everything up like I explained, and you're good to go. So it's really that simple. And I think people are more afraid of it because it's more of like a cultural thing. It's a little taboo, but this has been going on for thousands of years. And for people that, if you ever talk to elderly people, they'll tell you that that used to be one of the main forms of treatment for all kinds of things is actually enemas. So don't be too scared of it. It's a little bit different and awkward and maybe not something you've done before. So, it might take a little bit of mind coaxing, but I encourage you to give it a try if you are not in a flare and see if it doesn't help your symptoms. I think it's worth a try and just, experiment for yourself. So I'd love to hear your feedback. If you've ever done a coffee enema, comment below and let me know if you've done it. What do you think of it? Do you have good results? And I want to hear from you also. So I hope you liked that video. If you did, please give it a thumbs up and click the subscribe button. And also be sure to check out my website in the link below. There are free downloads for all kinds of things that have to do with ulcerative colitis and inflammatory bowel disease. And I have a new self-guided online program, the IBD Solution. So this is everything you need to know to heal your gut from ulcerative colitis. All right, with that, I'll see you in the next video.